Welcome to Lymphatic Insights. Today I talk with Dr. Travis Johnson. Dr. Travis is redefining health and longevity as the owner and lead chiropractor of Hudson Spine and Health. A pioneer in merging ancient wisdom with modern biohacking, Dr. Johnson integrates advanced chiropractic care, cutting-edge regenerative therapies, and metabolic health strategies to help people unlock their full potential. Certified in advanced biostructural correction, cranial sacral therapy, functional cranial release balloon, and posture optimization, Dr. Johnson brings a multi-dimensional approach to healing, addressing physical, chemical, and emotional imbalances. With a background in kinesiology and advanced training with NFL chiropractors and top functional medicine practitioners, he is on a mission to revolutionize holistic healthcare. Well, hello everyone. Welcome to Lymphatic Insights. I'm excited to have Dr. Travis Johnson with me today, an expert in his own field. Going to love having a conversation around fascia and going into things like glymphatics and endonasal balloons. So welcome.
Hey, thanks. Appreciate it.
We always love to start with what does a lot of people don't know about you? Like, what is a little secret that you don't often share with everyone?
Yeah, so fun fact, I actually have like a small hobby farm just right outside of town here. And so on my days off, I will tend to the goats and the chickens and the ducks and the bunny and the cat and the dog and just a big host of animals that, need their attention. And especially here in Wisconsin, it's -20 today. So
Wow.
we gotta put the heat lamps on them to keep them from freezing and keep the eggs from freezing before we can grab them. So that's kind of a
That's,
fun fact.
yeah, that's incredible. I'll have to come and visit sometime when it's not freezing.
Yeah, wait till the summer and you can go through the trails.
So obviously our focus is a lot on lymphatics. So I'm just going to start with a couple of questions on that and then work into this discussion around fascia and tension and also from a treatment standpoint. But if we come back to, what is your understanding of the lymphatic system and what do you believe has been, what it is its crucial role in optimizing health?
Yeah, so when I first understood the lymphatics, from education, it was really just around kind of some immune response reactions, and when you're sick, you want your lymphatics supported, and so what evolved from what I learned in the university compared to actual clinical practice was, well, there was a lot more going on from a detoxification standpoint, and I didn't realize that detoxification meant like toxic materials, like let's say like a microplastic, but you don't really think of like a microplastic as being something that would even really go into our body. And so my understanding of the lymphatics really enhanced when I understood that there was a lot of these other toxic burdens that we're getting exposed to in the environment that would actually flush through our system. um, and understanding like, well, what system can actually support, say, like a big material, and the lymphatics was one of them, that it has these big gaps so that you can actually flush some of these bigger materials through the body and get rid of them out of the tissues. So that was probably the biggest aha moment, I would say, recently, of furthering my understanding of how this system actually supports the body.
And what part of that knowledge now plays a role specifically in your own clinic? So let's talk about a little bit what you do first so people understand or the audience understands what you're actually doing in your clinic, and
Right.
then how that information of that lymphatic system approach has influenced what you do today.
Yeah, so I run a chiropractic clinic here. It's very integrated. So we utilize many different therapies. And basically, what happens is when somebody comes to me, I'm really the master delegator. They come to me with their problems. I'm going to push them in the right direction to what they need from a therapy standpoint, a bodywork standpoint, a practitioner standpoint, and kind of just give them a real, genuine solution to hear what they have to say. And then, hey, based on my knowledge, this is what you should do. So typically, what that looks like is they would see me from a practitioner standpoint. I do a full body history and evaluation, So I'm putting my hands actually on them. Unlike, I say, a lot of practitioners just like talk to you and tell you what to do. I put my hands on the patients. I feel all the fascia connection, looking at spinal, alignment, looking at tension, stress, reflexes, just kind of a full body evaluation. Then we'll kind of run them through a specific therapy that day too. So I want to give people a good experience when they come in, and so I have them go on a specific therapy that's very, I guess, beneficial for what they're coming in for. So we don't have time for all of them, so we'll just do one, and then from there, then we can kind of talk about what treatment specifically they need from a chiropractic adjustment standpoint. But we also have, massage, all the traditional other stuff here as well. We do some hair tissue mineral analysis. We do some emotional kind of consulting. Pretty well rounded, I would say, from a integrative kind of longevity clinic. And then basically how we utilize the full presso specifically is, I would say, what we call a body recomposition or body recomposition program that we run for individuals who are looking to reboot their metabolism, looking to increase muscle, decrease body fat. But I also, what I find with these people is they're highly burdened with just different toxins, and they feel crummy, and they have fatigue, and they have pain, and they have inflammation. And so it gives me an in to kind of start that conversation with them that, I understand you just want to lose body fat, but understand that, like, what's inside of that fat cell. We understand that a lot of these things can just lie within our fat tissue. So if we're going to eliminate that from your body, are you prepared and are educated enough to know that, well, when those toxins leave your body, you may feel kind of run down, and understand that, like, it's not a bad thing, and understand that that's actually what we would call a healing reaction. That's a positive path in the right direction. So it's really about having these really deep conversations with these people, to speak to them, and understanding, like, when they go through some of these protocols and processes with us, it's going to be a roller coaster.
Yeah. Especially if you start moving the fluids. We all know what that does, right? So
Yeah.
I think one of the breakthroughs, like lymphatics, has all of a sudden got the limelight in the last probably 3 to 5 years. I mean, I've been in the industry 20, and it's all of a sudden. I'm sure it's something got to do with more, some of your movie stars getting lymphatic drainage and looking like they've got a skinny tummy afterwards. It got us going. But, it's become a lot more recognized. It's getting understood more. I mean, there's still a very minimal amount of education out there, but more recently we've started to now learn about fascia. So, I think, and of course those two are so interlinked and literally sitting on top of each other. So do you want to move into a little bit more of a conversation around that relationship, and again, the work you're doing and what you're seeing? Because we know that if there's, for example, resistance in the fascia, it means lymphatics isn't going to drain so efficiently. Is that your understanding?
Correct. Yes, they're very much interconnected. I think fascia is really interconnected with every system, to be honest. But basically, what I'm doing from a fascial standpoint and chiropractic standpoint is focusing on the fascial adhesions that are throughout the body. And with the technique that I'm doing, the ABC technique is what I perform, advanced biostructural correction, which actually is a huge technique out in Australia.
Oh, really?
Yeah, if you look up ABCI International, there's a huge provider list in Australia. If you want to see and experience the ABC adjustment, I would suggest looking that up. And then the endonasal, or what I'm trained in specifically, is the functional cranial release, where we're adding some neurology on top of the adhesion release. But what I've noticed is people come in, we say tension, but it's really broken down. We've broken down mechanics, which causes increased tension in the fascia. And when you have increased tension in the fascia, you get these closed off systems, right? So you're clenching down on the circulatory system, clenching down on the lymphatics. So now you're getting like backup. I had a patient come in, last week. She, you could literally see like fluid just hanging around her collarbone,
Wow.
and and you dive in deeper into those questions, and well, she had a thyroid removal, right? Scar tissue. So the
Hmm.
scar tissue from that thyroid removal literally would like not let those drain at all. It was just stuck there. And if you think about that, like if you have stagnant water or fluid, like a pond, right? Love this analogy, right? The swamp or the river, right?
Yeah.
What's going to happen? Well, you're going to have a feeding ground for infections and toxins. So when you have fascial adhesions, we need to release those fascial adhesions so that we can turn that pond into a river and flow it down. And so I focus on the fascia that's deep within the brain and the fascia that's deep within the spinal cord. So those are very fundamental from an autonomic nervous system standpoint. But I also look at the body, extremities. I'm looking at the torso, your breathing, diaphragm. Again, full body evaluation to see where are you holding this fascial tension or adhesion, and so we can release it. And there's like 10 different techniques I can use to release fascia. I won't go into all of them unless you want me to, but um, I would say if we take down some of these fascial walls, you'll feel a lot of weight lift off you, especially from an emotional standpoint, but from a energy standpoint and just mood, and then pain. We understand when you have swelling and tension, your nervous system tells you, "Hey, that's not right. I'm going to give you a pain signal." And so when we start manipulating joints and we start breaking up fascial adhesions, the body really does, well, I consider unwind. Okay, so I like this analogy too. If you had a dish rag, but if you had a dish rag and you twisted it up right from both ends, what would happen is the water in that dish rag would all leave, right? So if we're tight, we're dehydrated. And then if I unwind that dish rag, right, and now it can fill back up with water like a sponge. So we want to be more flowy. We don't want to be tight and stiff. That's what's going to retain proper fluid and fluid exchange through the tissues. And so when we come to the brain and we talk about endonasal stuff, now we're going into the glymphatics, the glymphatic drainage, brain health, cranial nerve function, and again breathing, like oxygen saturation into the body too. Um, so you let me know where you want me to go with that. But fascia plays a huge role in the lymphatics on its ability to basically flow freely.
Okay, so before we move on to more on glymphatics and the nasal balloons, which I'm fascinated to learn more about, let's just go back to your comment about the emotional relationship in fascia, because in lymphatics we're taught it's all about letting go. So what are you holding on to? But they're saying now that fascia is where we really hold it all emotionally, even like so that I think just for the listeners, understanding that a fascia release has this roll on effect where you can have quite an emotional shift in life. So is this the kind of thing that you're meaning with that comment?
Yes. So when you release these fascial adhesions or fascial tension in the body and its relationship with, say, a particular memory or emotion or feeling, they can correlate to, I guess, memories, right? So it could be a past memory that is stored in a specific part of the body. It could also be like a physical traumatic event that you went through and the emotion associated with that event. So there are many times where I will notice people, get a little emotional when you hit those specific traumatic spots, and it could be a traumatic, psychologically, but it could also be physically, and even chemically. And so all three of those play a role in how somebody may perceive a treatment. And I always like to bring this into the breath as well, because we do train a lot of breath work or diaphragmatic type breathing where you're actually like trying to breathe. And when you start breathing in a very volunteer way, you'll also notice that your brain starts to kind of go into these different emotions and thoughts and ask questions. And those are all good. Those are all good healing techniques to, like you said, let go of past. Because if you don't let go of past, or another way for saying this is forgive,
Mm.
then it's really hard to go into the future and plan for the future, or become your best optimal self if you're holding on to old. um, and again, old to me from a cellular standpoint is those zombie cells, those senescent cells, right? It's the old dead cell that's already used its energy, but it's still holding on, kind of getting freebies, right? And
Yeah.
so we need to let go, like literally, with these cells that don't serve us anymore, but then also the emotion that was associated with that cell when it was created. So we understand that I'm not the same human body I was, 90 days ago or 7 years ago. I'm a completely different set of cells. And so, what are you telling your DNA to create, in the next coming years? And so, that goes a lot with how our mindset is, and what kind of roles it plays with our bodies and our emotions and our relationships and our choices.
Yeah, we often, we used to, well, in my training, I think some of our techniques were releasing fascia as opposed to as part of the lymphatic drainage. So it wasn't uncommon, especially I used to work with a lot of breast cancer patients, for them just all of a sudden to go into tears and not really know why, which was really good because then there was no story around it. It just was about letting go. And I think people underestimate the value of how much that actually uplifts you as well. So the heaviness of that is no longer stored in the body. So for me, I think those things need to be discussed more often about it's actually okay. And, if we understand we trap or store this emotion as part of it, we seem to be able to be really okay with letting go of toxins and detoxing and stuff like that. But it's that emotional component. And then coming back to your comment about breath, like for us from a lymphatic point of view, it's so imperative to improve the breathing. Like, okay, yes, we're all breathing because we're alive, but it's actually the functionality of how we're doing that, because we see it a lot in, especially, when you're dealing with either leg lymphedema or leg swelling, and then of course, especially around the chest wall, we see it a lot when they're not moving the diaphragm sufficiently, because to get fluid from your legs, you're literally trying to pull it up from up against gravity and through the diaphragm, through the thoracic duct, right? So just cover, like, not so much in depth by any means do you have to, but just a little bit more about your education around breath. So you're teaching them different techniques, is that correct?
Yeah, I find with my patient base that they really are not doing proper breathing barely ever, even when they're exercising. So I'm a huge nasal breath, uh, I'd say, provider. So I,
Mm-hmm.
I I teach on nasal breathing quite a lot because obviously it helps increase our ability to get oxygen into the body a little more efficiently, but also the other effects of this too. Because if I want to talk about breathing, we can talk about diaphragm, and I think everybody kind of understands, like, okay, we should try to breathe through our belly, but you should just autonomically be able to do that. You shouldn't have to think about it. It should just be a natural breath technique, and maybe you do have to train a little bit to understand what that feels like. And I would say the majority of the population doesn't even have that skill. It doesn't even have that muscle and brain, awareness to, oh, you can do that. So that's basics, right? And core, kind of core strength as well. It kind of plays in a role with that as well. But from a breathing standpoint, I really hone in on the nasal breath stuff, because mouth breathing has shown to have so many other deleterious effects on our oral hygiene, our jaw alignment, and our tongue position, and it creates a lot of issues within the face. And so I do tell people to enhance their nasal breathing, especially even just going out for a walk. But then also the big one is sleep. What is your sleep patterns like? Position, of course, but also breathing patterns. Do you snore? Do you breathe through your mouth? Do you sleep on your stomach? Right? These are all really important, easy questions that we can address, and ultimately we want them to have a deep restorative sleep, and obviously with all these tracking measures, I know you mentioned like the heart rate variability devices, we can actually tell whether we are having optimal sleep or deep sleep or REM sleep. And it's not about just getting the 8 hours, it's about what percent is the actual proper sleep state we're in. And a lot of that is due to our ability to breathe.
Yes, very much so. I've seen it for years as a problem. And that's why, it's, I mean, I was with Dr. Nathan Bryan the other day. We did a podcast on nitric oxide, and of course, nasal breathing improves nitric oxide. So, there's so many benefits, but I didn't realize quite to the degree uh, how nasal breathing is not something that's common these days. It's actually more uncommon. Fortunately, I've been able to nasal breathe all my life, but it was more, I didn't realize it was such to the degree till I sort of got talking to a lot more people in America that I understood, and then you look for it here in New Zealand. So, well, this is a great segue into the glymphatics and, of course, moving into the endonasal balloon. So, go on, teach us more about that. I mean, we've only just learned that we've got this glymphatics in the last 10 years. So, tell us some more.
We'll start in that. Let's just start in that pathway of when you breathe in, right? So we can just take a sequence of events that happen as we breathe in. Let's just say clean air, right? So that's first and foremost. Like, what are you breathing in? First of all, what's your environment in? Let's make sure it's clean and not full of these, particulates in the air that we have identified that we don't know where they're from. So we can talk about, air filtration devices and things like that, and mold. So let's just say we're breathing in pure, clean air through the nose. That air is going to pass up through the nasal passage, and that air is actually going to pass right through some bone structures and neurological structures for smell, but also for some ionization through the brain. Okay, so it's going to come in through this nose, it's going to pass through the bottom of our brain, come back through in the front of our spinal cord, and then into our lungs for that oxygen exchange, right? So it does a lot before it even gets to the lungs. And I think this is a big misconception that we're kind of missing that piece. And this is kind of where the glymphatics kind of lie as well, because lymphatics is a lot of mineral and electrolyte balances within the cerebral spinal fluid. Okay. And if we don't have proper, I would say, raw material to actually support the brain's natural function, then it's really hard. It has to grip it from other places of the body. And so you start with your ability to breathe through your nose. You talked about the nitric oxide you're released. So we're getting that vasodilation, increasing blood flow to the brain, passing through that that blood-brain barrier, and also what things can enter that blood-brain barrier, what things can't, right? So we have to really understand which things are small or big enough to get in and out of that barrier, so that we can really understand what parts of the brain we're affecting. Okay, lymphatics to me is the fluid that surrounds the brain, the cerebral spinal fluid, and it's washing away particulates and toxins and heavy metals that have been accumulating in there for whatever reason. Maybe you were a welder and you've been breathing in fumes your whole life. Well, guess where the first place that metal is going to go when you're breathing that in? It's going to go right to the brain. Maybe you have teeth amalgams. Well, guess what? That has an instant, connection to the brain as well with the amalgams. I, I can tell you a lot of personal stories with people having brain dysfunction, mental health dysfunction, cognitive, sleep, anxiety, all of that based on an imbalance in minerals and metals. Okay. And the glymphatics are, I believe, a huge part to release this when we're talking about fascia again. Okay. So, glymphatics, you got the fluid going around the brain tissue. What's holding all that brain tissue in place is the meninges, the neuromotor. Okay? And this is where the balloons really shine, okay? Because we have the meninges that start right here in the front. So think of the connective tissue. It literally starts and anchors itself right at your face, okay? And then it wraps around and through the middle of your brain, the felt cerebri, right? And then it comes back down the spinal cord all the way to your tailbone. Okay. So if you have too much tension or even adhesions within this dura mater, it could be from a brain injury, it could be from a poor delivery when you were a child, it could be a malnutrition thing when you were a child. We don't really know or understand the depths of this, but I can tell you when we test for these balloons that it's really easy to identify somebody who has an issue there. What I do is I look at your eyes, okay, and I can look and track your eye movement and your eye gaze, and that will determine the actual neurology and the reflex that you have that can be restricting within a certain side of the brain. Okay, and you can actually look at the if you look at the whites of your eyes,
Mm-hmm.
that's just an addition to your brain tissue. That is the meninges, the white. That's the dura part. So as we do these balloons, which is really simple procedure, it's just we put a balloon in a very specific part of the nasal passage. I test specifically what chamber and location we want to put it at, and that's going to correlate to a a part of the sphenoid bone. Okay, and so the sphenoid bone is this wing bat looking bone that's right behind our eyes, right behind our nose. It's the keystone to our skull. Okay, every skull bone attaches to this bone. So if there's a tilt or a twist or a tension, or maybe you've had a concussion, this will affect lymphatic flow. It'll affect your neurology, so cranial nerve function, and it'll also affect your ability to exchange gases through your nasal passage. Okay. So first and foremost, we need to open up that nasal passage with that balloon. We expand it. It will expand. It will release fascial adhesions, and you can sometimes feel and hear these. So a little crack and pop. They're painless. They're just kind of like whoa. And then you'll also notice, at least I did when I had this done, you'll notice a little bit of a suture kind of release too. So I actually felt sore, like on my face here, 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 all these different suture lines of where these bones are connecting. You'll feel sore there because, contrary belief, these joints do move, even though they're immovable. And then also this brain release that you're getting. So again, stay with me here. When we do the balloons and we're releasing that sphenoid bone up, we're also putting pressure. So this is like flow presso for the brain. We're putting pressure against those ventricles that are housing that cerebral spinal fluid. So now that pressure increases because of the balloon, and it's moving up to the deeper parts of the brain, and it's going to eventually wash over pineal. Okay, that's the end
Mm-hmm.
stage of it.
Mm-hmm.
And so when you get a forced cerebral spinal fluid pump, it's like a brain reset. It's like
Wow.
your eyes function perfectly. You feel lighter. You get a big kind of endorphin release, and emotion. Like I've had a lot of emotional releases happen because of this, because people are so in their head. They think nonstop all day long, and they're like, yeah, like we talked about the fear response. Like I'm afraid of for my life every day. You do this treatment, and it feels like the pressure of your head and the world just literally leaves, and you get into this deep parasympathetic state, which is like foreign to a lot of people. And and they appreciate that. They're like, wow, like I never feel this way. And it's like, exactly. How can we get you to feel like this more often, right? Like, I don't want you to have to come see me to do this, and this is where we talk into the lifestyle piece. But the functional cranial release, the endonasal balloons, is a profound way to get some of the glymphatics moving from a therapeutic standpoint. Um, and then the cranial sacral therapy, which is kind of what I do at the end to kind of flow it all into place, is a very gentle technique to allow these things to kind of happen as a gentle and therapeutic, integrative way.
And is it kind of like a one reset? Like, is it just you get the reset done once, or do you find that you may need? So, for example, I told you earlier I'd been in a bar and there was a brawl and I got my nose broken. I just happened to be in the wrong place, wrong time. And so, if you do that, that would obviously support that an awful lot, and hopefully I'd be even more clever in my brain. Uh, but more to the fact, but is it something that you find over time can revert, or is it kind of one of those things once you, like a scar, once you can really release the scar's released?
Yeah, it is pretty permanent when you get it done. So I would say most people require more than one, because there's a learning curve when we do these. Everybody has a very unique uh, history and nasal passage. I would say orientation. People have different cartilage in the way, different deviated septums. People have bigger sinus passages, so some I can use more, pressure with. Some I have to do less. So the first one is really like, at least the way I do it is, it's like a evaluation and a treatment. Okay, I'm gonna see and feel what it's like in there, and while I'm in there, I'm gonna give you that gentle release, so you have a good understanding of this is what it feels like. That wasn't that bad, like I thought it was gonna be, and then you can kind of ease into, okay, I think you can handle two, like you can have more pressure. And then we can go slowly increase with that pressure till we get that therapeutic, like, wow, that's what I needed. That's what you were talking about. Typically that's a minimum of, I'd say, 4 treatments. And the full protocol I do is 8. So you do twice a week for a month. And then you take a break because I want your body to integrate this for a while and sleep and do your breath work and exercise, and then we can retest with those eye movements and see if the dysfunction is still there or not. But I would say it's it's something, if you've had nasal like trauma, and you've had, like, for me it was asthma and allergies my whole life. When I was a kid, I would constantly sniff every morning, just, and that pressure literally built up in my deep face. And so when I got this done, it was just a complete release. And most profound treatment I've ever experienced was literally the deciding moment. I had to be an expert in this technique. And so I just find it so synchronistic that this treatment is perfect for something like what you offer in the Flopresso. And I've noticed a dramatic increase in results from the patients that do both the balloon and the Flopresso. And I'm kind of like a, experimenter a little way, with my friends and my family. Like, I still haven't done this, but I want to do this with somebody. Is you're in the performance mode Flopresso, and then you get the balloon. And
Wow.
I'm just curious. I don't know if anybody's done that yet, but I'll volunteer myself. I just got to find somebody that knows how to do balloons on me. So
Otherwise, maybe when we connect, maybe I need to be the big girl and get volunteer to you, and I'll get in. I mean, I know Mode 2 very well, so I'm not. But yeah, or we'll bring we'll use Freddie.
do it. Yeah.
We'll use him as our guinea pig. Oh no, that's phenomenal. You've given us some fascinating insight on quite a few things. Thank you. I really do appreciate it. And if there was just something you wanted to say to the listeners about, what would be one or two things that you would be recommending right now with the way just the world is and everything that's going on, like just for self-care? Like what would be one or two of those that you'd be, knowing what you know about fascia, breathing,
Yeah.
all this sort of information, what would be your go-tos?
Okay. Yes. So there's two sides to look at this. Now, I am probably a little biased because I own and operate a longevity clinic, right? So I have access to these high-end medical equipment that's going to make the cells and the mitochondria function like hyper ability, right? And then there's the side of, okay, what's completely found in nature, right? Not that it's very similar technology, but it's not at that therapeutic level, right? So obviously, if you have the ability to and you have the location to, seek out these clinics that have mitochondrial enhancing and detoxification type protocols, it is where we are in the way the world is right now, because we can't get away from the Wi-Fi, the LED lights, the toxic, in the air with all these vehicles. Like, there's no way. So we have to combat it from a health standpoint. We can't just undo the whole environment. So I would say, if you can, if you have the ability, you become a member at one of those. It's an investment in your health, so that you're not dealing with these chronic, metabolic and diseases. So other than that, I would say we have to connect with nature. We are very fastly getting away from nature with AI, with computers, with technology to keep our businesses going. I fully understand this as well. So we have to live a lifestyle in uh, in nature, and that should even mean your house. Like, your house and your home life should be as should be mimicking nature as close as possible. It should not be this cardboard box house with Wi-Fi, dirty electricity, all. No, it should be like an outdoor patio house, and you are getting out in the elements. So for myself, that I've noticed in the last year, that has been a complete game changer in my health and wellness, is this hormetic response theory, right? So, can I put my body through these hormetic stressors to enhance my body's resilience to stressful situations? My life is stressful, but it's a good stressful. Like, I don't feel like stress is a bad thing. It's about how you perceive it, right? So I go and do a cold plunge, and I perceive that as, this is helping me, not I am dying, right? Same with the sauna. So mindset, being connected with nature, getting your bare feet in the ground. I know you garden, like, get out there, get dirty, get your immune system acclimated to all these different microbes and viruses and bacteria. Like, you want that information touching your body, so that when you hit it again, it knows exactly what it is, and you're not going to get, bedridden. And so I honestly think that my advantage as a chiropractor, touching many different patients every day, all day, like, my immune system has built such a resilience that I just have never had a really response to COVID or, flu, pneumonia, colds. I just don't. But again, I'm living that lifestyle of hormetic response: get super hot, get super cold, run super long, lift super heavy. Um, you know, breath work, meditate, get super calm, right? Like, try to get all these different states in your body, so that you have this variety. Um, I think right now, a lot of people stay in the same state for long periods of time, many years. They go into this kind of dumbed, low down state of, I'm going to go to drive to work, I'm going to go to work, I'm going to come back home, I'm going to go to sleep, and they're just like coasting through life. And years goes by, and they're like, okay, I got my pension, I'm retiring, but I'm broken down, and I literally have no passion. You know, I have cancer. I'm going through chemo, and I'm retired. This literally happened to my dad. Like, he literally retired. He enjoyed 3 4 months, and then boom, got hit with multiple myeloma, and then he had to go through cancer, right? and then now he's on the recovery. Oh, cool. Oh, I should probably take this up now, right? Like that's where we're at with Americans. Like we're waiting till something, you know, puts us down, and then we'll listen instead of like, man, Dr. Travis is doing something right. Maybe we should, get onto this now so that I don't ever have to experience that. And so that's what I'm trying to like create with these people and my members is like, do something and experiment around and understand that, there's going to be things you like and there's going to be things you don't like, and you should be able to learn from both of those. And I just think having that mindset and um, and just being one with nature is just fundamental.
There's that old saying, prevention is better than cure, right? We can spend a lot of time being sick, like spend money on being sick, or we can spend money on being well. So, that's always how I've kind of considered it. I have to invest in my health to be well. We certainly don't have quite the overwhelming health issues you do in the US, but we're going there too. So, and we are more what I would call nature based here in New Zealand. But yeah, I think people underestimate their environment and their mindset and the what we've all been through with the stress in the last number of years and how it has put us into what we call Groundhog Day.
Yeah.
Thank you so much for your time. Thank you for giving us this incredible insight. We will have Dr. Travis's details there, so if anyone's in the local area or wants to go and see him, you can find him or travel by all means. And I believe we're connecting in April, aren't we, in Austin for the IHS conference. So I'm excited to actually physically meet you because I'm currently obviously in New Zealand. So that'll be really cool. We can talk more about lymphatics and nasal balloons and all the rest. So I'm very excited. But I do want to say thank you. I appreciate your time.
Yeah, thank you so much, Desiree, and looking forward to Texas. And I'll be at the booth answering any questions anybody has, or maybe we'll even do some balloon treatments. So
that would be awesome. Thanks again.